Welcome to Help! I Have Kids. I'm your host, Pam Marshall, a mom of 5 and a pediatric occupational therapist with over 35 years experience. This podcast is designed to equip you with practical tools, insights from experts, and real life stories. Because at the end of the day, you are the head of your child's care team. Each week, you'll hear from pediatric experts and fellow moms like you that will help build your confidence. They'll offer clarity and empower you to make informed decisions that work for your whole family. Welcome back. Today we are talking about maybe a fun topic, maybe not a fun topic. It's health insurance. We want to help you understand health insurance so that when you get therapy or any medical service, that you can understand what is going on with your health insurance. We know that moms, it helps them to be prepared and to have information, that getting surprise bills or not knowing causes stress. It causes you to not want to take your child to therapy or get the services you need. So we really want to equip you with some education today. And I have my friend Kathleen on with me today. Hi, Kathleen.
Thanks for having me.
Yes, and Kathleen is an insurance specialist. She knows all things insurance. So she's here today to kind of be the insurance whisperer and to hopefully provide tons of great information that will help you as you navigate your child's healthcare and health insurance. So, commonly asked questions, Kathleen, tell me a little bit about your position and maybe some questions that you get.
Yeah, so I'm a patient account specialist, so that means I manage each child's account. I'll manage bills and insurance payments. And then I'll also answer the phone when people have questions about their insurance coverage. So some commonly asked questions just really have to do with how people's insurance plans work. There's a lot of confusing different words. There's deductible, coinsurance, out of pocket, copay. So a lot of times people will call and just kind of ask clarifying questions to get more information on how their plan actually processes their claims.
Right. And just some basic information about health insurance is the terms like a copay. That's when it's a shared amount, but it's a set amount. So it might be $30 or $50 or $70. It's a set amount. And it's usually actually printed on your card, whether your plan is a coinsurance plan or whether it's a deductible going to apply to the deductible or whether it's, a copay. And our team does something great for parents. We help verify those benefits and review them with the parents before they even start so they know what to expect. And let's define for parents, what is a copay?
Yeah, so great question. So the copay is just a set flat rate that you pay at each visit.
Mm-hmm.
Um, and this, yeah, like you said, it could be $30, $35. Sometimes it's 10, sometimes it's 20. Just depends on the plan. But if a plan has a copay that applies to therapy care, it will be that flat rate for each visit.
Every time. Yeah.
Mm-hmm. Yes.
And then tell me the difference between that copay and what is a coinsurance?
So coinsurance is a little bit different. So before you start to pay coinsurance, your deductible has to be met. So kind of switching gears, the deductible
Yeah.
is that total amount you have to pay out of pocket before insurance starts to pay.
Right.
So yeah, so
In
if you,
common, you
Mhm,
see anything from someone having a very low deductible, like
mhm,
300 or 500. That's very low. Most people
yes,
have 2,000 or
mhm,
2,500 or $5,000 deductible. And then there's high dollar amounts like 10,000 and
mhm,
up.
yeah,
And that's also on the card, right? That
yes,
deductible is also usually printed on the card. And
mhm,
just to clarify, we're really talking about commercial insurance. We're referring to
mhm,
private insurance, not Medicaid or public state funded insurance. So today we're talking about that private
yes.
insurance.
Yeah. So there's definitely a wide range with deductibles. But then once that deductible amount is met, you may be responsible for that coinsurance amount, and that's a percentage of the total cost. So then
Yeah.
you'll pay that percentage, and then insurance would pay the rest. And we typically see maybe they refer to it as an 80-20 coinsurance, which means
Mhm.
insurance would pay 80% and then you would pay that 20%. But
Right.
it could be they might split it up 90% paid by insurance, 10% paid by the patient, or 70-30. So it can just depend. But those amounts can vary quite a bit compared to the copay. So the copay is always that flat rate, but then your deductible and coinsurance can vary a bit more.
Yes. And the coinsurance, the variability, sometimes parents don't understand that because as therapists, we bill what we do in each session. So, one session, for example, say you have a young child with feeding, and there might be certain codes that they do one session, but then the next session, they're not utilizing that code. They're doing
Mhm,
something different in that session. So, the coinsurance amounts may vary according to the CPT codes that they bill.
mhm.
And unlike, I mean, there's a lot of therapy companies that just bill rote billing, meaning they don't follow the guidelines of billing what you do. They might just always bill the same codes. So that's why it can look different sometimes
Mhm.
if you're receiving a service that utilizes different codes each session.
Yes, yeah,
So,
and I love to tell parents too when they have questions about that, that it's typically a great sign if you're seeing variations in your deductible and coinsurance amount per claim, because it
yeah,
means that your child is like advancing in their therapy and their care is changing, just depending on the visit. So it really is a good thing, although it can sometimes be frustrating to not have to pay the same amount each time.
right.
It is a good sign of things progressing and moving forward. So
And it can be
yeah.
confusing. Like, why is this
Yes.
changing? Right.
Yeah,
And
definitely.
the fun fact that we can talk about is parents actually, you all have information or availability to the information before the provider does. So we, the provider, like in our case, it's Marshall Pediatric Therapy, we, the provider, sometimes get the information after you. So claims and the information on a claim is billed electronically. I like to think of it as cyberspace, just do 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 going through
Yeah.
cyberspace and coming back. And when you log into your portal, your insurance portal, like for example, I know personally I have Blue Cross Blue Shield or Anthem, and I'll log into my Anthem portal and be able to see my claims or my estimate of benefit, or as we call it, EOB, an estimate of benefit. And different portals have different places where you go to look for that, but that will actually be in there. So when you have surgery or a major event, it's usually in there fairly quickly within 7 to 10 days. If the provider has billed that claim out, it's it's in your portal. You can see it oftentimes before the provider can.
Yeah, definitely. And it's super important to check that as well.
Mhm.
And yeah, it can give you a good explanation of how your claim may have processed and yeah, that everything, went through correctly and wasn't the claim wasn't denied.
Right,
So yeah, and that those do typically get to the members portal before we get it as the provider.
right.
So yeah, so you all as parents have the most up to date information, which is great.
Yeah. And I think it's great to have this information because no matter what service you're getting, whether it's therapy or whether it's a well checkup or a sick visit, or maybe you're going to a specialist and taking your child to a specialist, the EOB or estimate of benefit that you see on your portal should match the bill that the provider gives you. And ours
Mhm.
match exactly. Where no provider is allowed to do surprise billing. That's a thing kind of of the past. There are federal and state regulations that we're not allowed to do that. Like that isn't allowed. So we don't do that as a practice. We don't do any surprise billing. Our EOBs match what you can see in your portal, and your insurance company is actually the one that sets those rates. We do not, the provider does not. And I think some parents are very confused by that information. They think They think we, the provider, are setting those rates. So, it's great for you to always use that rule of thumb before you pay a bill. If you get a bill from a hospital, a physician office, any type of bill, medical bill you get, um, check it against what you see in your portal and make sure it matches.
Yeah, absolutely. And if a parent ever wanted to kind of double check with us and make sure everything's matching up correctly, we're able to provide those statements that show the way the claim processed on our end. And yeah,
Mhm.
like you said, everything should match up. Whatever insurance has on the EOB should match up to what we have in our system as well. So yeah,
Right.
that's yeah,
It should
definitely
all
great
match.
to. Mhm.
And I know we are sticklers about following rules, and we have our
Yes.
electronic medical records system set up to follow
Mhm.
all the rules, all the correct ways to document and bill and all of that. We even follow specific insurance rules because your specific insurance plan may have specific rules, like maybe they only cover 20 visits of speech therapy. So
Mhm.
we are going to set a counter that's going to count how many visits occur with us. And unless you've been somewhere else, now, if you go somewhere else for speech therapy and we don't know about it, it could be using, visits. If you visited once or twice to another location, you won't have the full 20 visits. You would only have, like, if you use two, you would only have 18. But we set a counter to match that so we don't ever go over and allow the family to decide. Again, we don't want any surprise bills. I know
Mhm.
I wouldn't like a surprise bill. So I know moms or dads listening, you don't want surprise bills either. So we really care about matching what your benefits and what your insurance company benefits are. So, in talking about the confusion of parents thinking the provider sets the rates, or the provider can just maybe not take a copay or not um, charge them for the co-insurance, I think it's really important, Kathleen, for people to know that we are in a contract with the insurance company and we can't break that contract. Like,
Yes.
they expect us to collect that amount because that's part of the whole, that's making us whole for the service. They expect us to get paid that whole amount. And insurance is actually it's a shared agreement now. There's really not any service, or very few, that are 100% covered. There's a patient shared amount that goes with
Mhm.
it. So that shared amount is the copay, co-insurance, deductible, all those things we
Yes.
talked about.
Yeah, absolutely.
Are there any other misconceptions you hear sometimes from parents regarding what they owe?
Yeah, I know sometimes parents will get that explanation of benefits or estimate of benefits in the mail, or EOB, which it's also referred to as, and sometimes feel maybe a little confused. It says, it has those big letters that say, this is not a bill on it. And you might see a really large number on there. There's, a bunch of different categories on there. So they can be a little tricky to read. But the most important thing for the patient or the family to look at is that patient responsibility category, which will typically be a column on the EOB. So that's like what we were saying. That would be the deductible, co-insurance, or copay, and that's what you would, as the patient, be responsible for.
Yeah,
So there might be a lot of different numbers on there, but that patient responsibility amount is probably the most important one to look at to kind of match up what you pay that day, and then what insurance processed the patient responsibility. So they
yeah.
can be a bit confusing to look at, but that one little section is the most important for sure.
I like to think of it as just three categories, really simple. There's an amount that was billed to the insurance
Mhm.
company, and that is typically usually higher than the allowed amount. The
Mhm.
insurance company, they're the ones that set the allowed amount. So let's just explain this in simple terms. They set that
Mhm.
allowed amount, and then there's a patient responsibility column
Yes.
or amount. So let's say that something was billed at $200 and
Mhm.
the insurance company says the allowed amount is $150,
Mhm.
but the patient responsibility is 50. So that means the insurance company is going to pay we, the provider, $100, and they expect the patient to pay the 50 to
Mhm.
come to the total of 150, which is allowed, even though
Yes.
what was billed was at 200. So that's a really
Mhm.
simple version of it. There's a billed amount, an allowed amount, and a patient responsibility amount.
Mhm.
And yeah. And so the other thing that's so interesting is the provider's in a contract with the insurance company. And then there are agreements and all kinds of rules between the patient and the insurance company as well.
Mhm. Yes.
Yeah. So when a parent has a problem, like let's say they had the benefit of 20 visits, like we talked about before,
Mhm.
but the claim comes back and denies it. Let's talk about that scenario a little bit because that does happen
Mhm.
where um, I call it the insurance game. Sometimes it's their system that accidentally kicks a
Mhm.
denial out, and there are little codes on the denial and the reason for the code. And these are all things sound like foreign language, right?
Yes.
Like parents don't understand them.
Mhm.
Um, but our insurance specialist, and hopefully any provider you go to has an insurance specialist that can explain that to you.
Mhm.
Um, Tell us the fun fact about when there's a denial. What are the things that a parent could do to help that denial get processed correctly and
Yeah,
corrected?
yeah. So I guess the fun fact is that parents carry a lot, or members, I guess, of the insurance plan carry much more weight when they call insurance
Yes.
compared to us as the providers. They tend to listen to families or the members of their insurance plan a lot better than they listen to us sometimes, unfortunately.
100%. Yeah.
so so we would always recommend you're always welcome to call us, and we're happy to
Yeah.
look into it and provide you with additional information. We can help with claim numbers or copies of EOBs, things like that. Make
Yeah.
sure everything was billed correctly. But then, if the parent is able to call insurance and advocate for themselves and say, like, I'm not understanding this denial, or it shouldn't have been denied, that can carry a lot more weight. They have a lot of strength to their words, so they like to listen to
Yeah.
members a lot more than providers.
That's so true. And
So,
we even offer getting on a three-way call. That's always
mhm,
helpful, but the parent has to initiate the call and then call us
yes,
into it. And we usually schedule those. And
mhm,
those are very helpful because you have we, the provider on the phone that understands what the issue is. And then you have you, the member that has the weight
mhm,
of getting this situation resolved. And there are to stand up for insurance companies, their systems are there are a lot of regulation and a lot of
mhm,
reasons why their processing system can process something incorrectly. We even have when things need require a prior authorization, there's a number and there's a count of how many visits go with that prior auth. And sometimes they process claims out of order. That's
mhm.
always fun when they do that, and
Yes.
we have to go back and go through the date of service. No, this
Mhm,
date range, this had this many dates of service, and here's the prior auth that goes with that date range and
mhm,
so forth. We have to and those things are a little more complex that we understand, so us getting on the phone, being a support to you to get it resolved, we want
mhm.
nothing more than you to not have to pay for something that is actually a covered service or benefit
Yes.
or should be processed and paid. And I know our team is excellent. We go to bat and really stand up for the member and for the family and the child so they can keep
Mhm,
getting services and getting that paid for. And we also don't get upset. We understand it's a process. So if you can take deep breaths and not become upset, that's also a really helpful. And you have such a calm demeanor, Kathleen. I know I've
Oh,
heard you
thank
on the
you.
phone before, that you're very calming to people. And once you understand insurance, you can take a deep breath and not get
Mhm.
upset. It's just a process we have to work through. And hopefully the outcome is usually favorable. I mean, very rarely do we have anything that doesn't get resolved. It may take a while
Mhm.
to get the
Yeah.
resolution, but we usually
Yes.
get the resolution. Yeah.
Yeah, absolutely. Yeah, it can be frustrating to call insurance and, have to speak to a bunch of different reps, but
Mm.
we can, assure everybody that we're on your side. We're here to help. So, yeah, we try to do all that we can, and as much
Yeah.
as it can be, long phone calls sometimes, it's definitely worth it if we can make some progress and get claims reprocessed and paid correctly. So, yeah, we're definitely on your side.
Yes,
Mhm.
100%. And another truth is you're actually responsible for your insurance, meaning um, you your insurance goes with your job or with your if you're employed and you have insurance and then you change jobs and get new insurance, it's your responsibility to immediately notify all of your medical providers. And so, like for us, a lot of times therapy is happening every week, and we can't, we're unable to get prior authorizations backdated. Insurance companies do not do that. So, if you do not notify someone like your therapy group immediately and we're unable to get that authorization before the next visit, you will be stuck with the bill. Like there's nothing we, the provider, can do. We can't magically backdate a prior authorization if that's required. So, keeping up with your insurance is so important. It's number one if you have an insurance change. In fact, you should stop services if you're not sure what that number is or what's needed. If it went into effect on April 1st, then you should not have services past that April 1st until you know what your benefits are and what it's going to cover and what to expect and all of those things, unless you just want to take on the liability of paying out of pocket. That might be the case. So I think that's a confused thing as well. Do you have any tips for parents along those lines?
Yeah, I would definitely just maintain good communication with your providers, whether it's us or a different provider. And we have families all the time kind of letting us know that they'll be maybe switching insurance plans the next month or in a few weeks, and just maintaining that constant contact and providing us with those updates so we can make sure that we build the right plan. Um, and do everything we can to make sure that those claims are all processing and aren't denied just in that transition when switching plans. So yeah, that I guess
Yeah,
communication is key with that
that
one.
works.
Definitely.
So, the other confusing thing that parents don't understand is if each parent carries an insurance, how do you know which one is primary? Like if the dad carries one and the mom carries one, and you have to know
Mhm.
which one to bill first. And can
Yes,
you
so
explain that?
it
Mhm.
has to do with the person that holds the insurance, their date of birth. So the primary plan is within a calendar year, whoever's birthday comes first, that would
Mhm.
be the primary insurance. And then whoever's birthday, comes after that would be the secondary insurance.
Right.
So, for example, if mom's birthday is in February and then dad's is in July, mom's insurance would be
Mhm.
the primary and then dad's would be the secondary.
Yes.
Um, and that's just insurance's rule with it. It's just kind of what we have to follow. That's how they
Yeah.
kind of order those plans.
Right. And we've had parents before say, "Oh, no, 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 I want you to bill this one first and this one second."
Yeah.
We're like, "Well, we can't choose that. It is based on the birthday." A lot of people don't
Yes.
understand that. And another fact is sometimes parents think it's really helpful because you're paying oftentimes good money for those commercial
Mhm.
insurance plans. Sometimes parents who have children with complex needs will go and buy 2 insurance plans, and they'll have Medicaid as a 3rd plan,
Mhm.
and sometimes it's not all that helpful to spend the money for 2 commercial plans. Sometimes it's more helpful just to have 1 and to have the Medicaid secondary. Um,
Yes.
so it's good to talk to an insurance broker or someone with experience and to research it before you decide to do that, because sometimes
Mhm.
it really can backfire and be more difficult having 2 commercial plans and then a Medicaid secondary.
Yeah, definitely. Mhm.
Mhm. Yeah. And anymore, there's a lot of providers that don't accept all the different types of insurance. They may only
Mhm.
accept one type or, not the other.
Yeah. Mhm.
Okay. So if a mom wants to get ready for a service, are there magic questions the mom should research or ask their insurance company before they call? And how do they contact their insurance company? How do they even know who to contact?
Yeah. Yeah, great question. There actually are magic questions that can really help. So the first thing to do, you can either look on your insurance card. There should be a phone number on the back of it for member services, and that's who you can call. And then if you have an online portal where you can log in, there might be a feature where you could chat with a representative. It
Mhm.
probably would just depend on the plan, but there's kind of some different options of how to contact them.
And it's
But yeah,
probably a bot at first. You
that's
get
true. Yes.
you get the robot at first, and so you just have to push past the robot to get to a person. Yeah.
Yes, yeah. Normally, if you continue through the robot's prompts, you can get to a representative. So
Mhm.
yeah, you definitely want to get to a real person. That's a great tip.
Yeah.
Um, so some of those magic questions, like you said. So the first one would be asking whether Marshall Pediatric Therapy is in network or out of network with your insurance plan.
Mhm.
Um, Sometimes plans will have out of network benefits, but the costs can typically be much higher. So we would definitely recommend making sure that you're in network with us. Um, and yeah, it can just lead to much higher costs. So being in network is the best case scenario for that. And then we would also recommend that you ask whether the plan covers habilitative therapy, which means you're learning a new skill, or if it only covers rehabilitative therapy, which
Right.
is regaining a lost skill.
Right.
Because therapy at our clinics
Yeah.
typically falls under that habilitative category.
Right.
And yeah, insurance kind of can differentiate between those two. So we'd want to make sure that that's
So,
covered.
parents, to help you a little bit with that, the
Hmm.
rehabilitation is like if your child had an accident, injury,
Hmm.
or insult. So, if they had a TBI or if they were involved in a car accident or something like that, that would be considered rehabilitation if they lost a skill and they have to get it back. Like,
Hmm.
say they broke their leg and they had a lot of complications and maybe they need to relearn to walk and they haven't walked
Hmm.
for 10 weeks and they have to relearn. That's really rehabilitative. But a child who is 4 and never learned to walk and has developmental challenges, that child would be in habilitative
Hmm.
therapy because they haven't learned the skill yet. So that's
Yes.
kind of the difference that'll help you. Hmm.
Hmm. Yeah, and then that leads us right into that third magic question to ask. We'd recommend that you ask if there's a benefit exclusion for developmental delays,
Hmm.
just because so much of therapy done does fall under a developmental delay category. And some plans will only pay for therapy if it's due to some sort of injury, like we were kind of talking about with the rehabilitative versus habilitative. So let's say a child breaks their arm, and then they have to get rehabilitative therapy. They don't always cover those developmental milestones. So that would kind of be the third
Right.
question to make sure that those developmental delays would be covered as well.
And that most often happens with speech therapy. There are a
Hmm.
lot of plans that are trying to exclude it now.
Yes.
So it's very important to know the diagnosis code and to know exactly what to ask for. And those are things our practice helps with. But if
Hmm.
you're maybe some parents listening are in another state or another part of the country and you want to know what to ask,
Hmm.
we do have a very comprehensive list that we ask when verifying benefits. It's a very yeah, comprehensive, making sure we're asking a lot of questions about exclusions. And so to get the best information or the most detailed information, because sometimes they'll say, oh, yeah, we cover speech
Hmm.
therapy. Well, no, you don't with this diagnosis code or this.
Yes.
And a new little game that started in January of 2024. This little game is the Centers for Medicaid Medicare puts out a list of diagnoses and they're in categories, and they decided to take the developmental um, category, the developmental delay category, and process all of that under mental health
Yes.
and under mental health benefit. And
Hmm.
while many plans have a mental health benefit, most of the time it has a higher cost share than OT, PT, or speech does.
Hmm.
So that's a fun little game. And that's nothing we, the provider, can control. That is just your insurance company, what they're choosing to do and how they process it. So they process it as a mental health benefit, even though it might be physical therapy or
Hmm.
occupational therapy or
Yes.
speech therapy.
Yeah.
And that's a fun little game they're playing lately.
Yes, definitely. Yeah, it's they have a lot of little rules sometimes, and just one difference in a diagnosis code can kind of change the way a claim processes. So yeah,
That's
it's
right.
yeah, all kinds of different things that can happen.
Right. And it's really important for the provider to know what they're doing because sometimes the provider has an option. There might be 2 or 3 diagnosis codes that that child is treating for. And they
Hmm.
need to know if that insurance company is only processing the claim on the first one, that
Yeah.
maybe that first one needs to be moved. It's not the primary. You need to have the primary diagnosis in that first spot. So
Hmm.
that's also very important to know is your provider may not be aware of that, or they may not be following the best practice rules of which of those diagnoses goes in which. It's called diagnosis pointer, but which one goes where. And
Hmm.
that's very important to put the primary, the highest specificity.
Hmm.
That's what we call it, in the highest, in the number one spot. So the
Gotcha.
claims process correctly.
Hmm.
Mhm. Yeah. So we hear about um, insurance changes. When do insurance changes usually occur? Like somebody, works for a company, it's the same plan, the plan number didn't change or anything, but it's now January and the person's not aware that the details of their benefits
Hmm.
really have changed. They just don't know it. So
Yes.
talk to us a little bit about that, about helping parents be ready for that.
Yeah, so there can be a lot of changes with insurance plans just as the years change. So
Mhm,
typically see it right at the beginning of January.
mhm,
Um, a plan could stay the same, like you said, have that same ID number, same group number, but then the details of the benefits of the plan could still change. So that is something that we try our best to verify on our end. But then we'd also encourage families to reach out to their insurance companies to see if anything has changed or kind of ask them questions on that.
mhm.
And then typically you can find a like benefit booklet in your portal that would have it's probably really long, but if you can kind of search maybe
Yeah,
speech therapy, you could maybe find that section that talks just about speech therapy
right.
benefits and see, oh, has this changed from 2025 to 2026? So yeah, that change in the year definitely can bring a lot of insurance changes too.
Yeah, I think the portal is a great help because it can
Hmm.
take a lot of information and allow you to search for just the thing that you're. So, like you said, if it's just
Hmm.
speech therapy or it's mental health services or whatever it might be, um, you can get that up to date, read it, that
Hmm.
benefit right there. That's a great idea. You can even print it. It's helpful to
Yes, yeah,
to
for
print it
sure.
once you find it. Yeah.
Yeah.
Um, so I want to go back to more about detective work, like when something is denied or when
Mhm.
something is processed incorrectly. And one thing we do as providers is we get a reference number. So tell us a
Mhm.
little about that. What we do with that and why we get that and
Yeah. So reference numbers can be super helpful. So anytime either we call or a member calls their insurance plan, the calls are being recorded
Mhm.
and transcribed. So your insurance company probably has all these records of different phone
Yeah.
calls that they keep track of. So that reference number that you can get at the end of the call is linked directly to that conversation, and you could read through that transcript if you needed to. So representatives of insurance companies, they can make mistakes. So if we have that reference number, we'd be able to kind of compare the information they're giving us. So let's say on one phone call, a representative says, "Oh, this claim should not have been denied. We'll get that reprocessed like everything looks right." And we have that reference number. And then the next time somebody calls, maybe they say it was denied correctly and they're not going to reprocess it. Those reference numbers would help us kind of compare, and we could kind of bring those up and say, well, the last time we called, you said everything looked good. So it's we kind of say that it's like a receipt. You can use it to pull up that phone
Mhm.
call and use it to kind of dispute a denial. And yeah, kind of hold everybody accountable to what they told you.
So that's another fun fact for parents to learn is your provider should be making calls on the claim and getting a reference number as well as you. So when you
Mhm.
call and you discuss the problem or the denial with them, the date of service, the details, you ask for a reference number. So you usually get the first name of the person you're talking to, and the reference number sometimes can be a big long number like
Mhm.
8, 10
Yes.
digits or more. It can have letters and numbers and it can be a little confusing, but definitely taking good notes and keeping that reference number. And I know we, the provider, we put it right in our electronic medical record system and make a note of it so it never gets lost. And anytime we have a reference number, it's right there. So that's good. I bet there's a lot of people that don't know, you ask for that. You ask for that reference number and name of the person. Okay, so insurance, it can just be kind of boring, dry, but so important because it can
Yeah.
cause us so much stress
Mhm.
and anxiousness and uncertainty, and can even have people choose to not go get medical help or not get therapy
Mhm.
services for their child because they feel so fearful or unknown about it, or I can't afford it, when maybe they really can. Maybe it can be a surprise that they can really get that service.
Mhm.
So if a mom is staring at a bill and she doesn't understand it, can you just repeat again, what are the steps? She gets a bill
Mhm.
from a provider that says you owe X amount of dollars and she's
Mhm.
trying to understand it. You just repeat those steps. Like, what would you do? You're about to be a mom, which is so
Yes.
great.
Yeah, it's so
Yay!
exciting. Yeah.
And so, as a mom, what would you do?
Mhm.
What would your steps be?
Yeah, so the first step I would say would be to call the provider's office. So if it was a bill from Marshall Pediatric Therapy, I'd call our billing office, and we may be able to answer those questions and explain everything to you. It might save you from having to make an insurance call, which can typically take a little bit longer. You don't have to, wait very long on hold or anything like that if you call us. So I would definitely recommend calling us first or calling the provider first to see if they can kind of clarify and answer where maybe that balance came from or help to explain the way a claim processed. And then at that point, we could kind of point you in the right direction. If we thought, maybe if you called insurance as the member, that could help us to get a claim reprocessed, or kind of fight against a denial, something like that. We
Yeah.
can point you in that direction. We can provide you with information on the claim, date of service, or which is the visit date, and then even the claim number that a insurance representative would be able to pull up in their system. So we can definitely help to point you in the right direction and give that extra information and guidance on the next steps to take.
Yeah, I love that you just reviewed that. So that's such a great skill set to have as a mom. You're going to want to do this every time you have a problem. And
Yes.
a lot of times it can be handled fairly easily. So I know sometimes I'll not want to do things because I think it's going to take hours and hours and hours when actually just jump in and do it. This isn't going to
Mhm.
take that long. You really can get things handled because we all don't have a lot of time, especially when we're raising our babies and
Yes.
our families and we're working and all the things going on. So, I hope that you hear the message, parents, that you're not alone in this insurance journey. I know we would love to answer questions for you if you want to reach out to the social media on the podcast and you have additional insurance questions. We'd love to answer them for you or be a resource. Um, but we just cheer you on. Like, know your plan and your benefit. Know that your provider, like us, we're a provider. We really don't have anything to do with what your insurance benefits are. That's your plan. That's your insurance company that sets that. It's also your insurance company that sets the rates, like what the shared portion that you have to pay. It's not us. Um, so that's also helpful because you want to be a partner. Like we, the provider, we want to be a partner with you in this therapy journey. We want to partner both in understanding insurance as well as the clinical side. And what's true about our team is our billing office really has very little interaction with our clinical team. So that would be like the people you see when you go see a doctor, you come see a therapist. That's called the clinical side. And we're just handling the insurance billing, authorization, all of that side of it. So we really don't know what's going on over here. That would be the clinical team that would have to answer questions for you there. We just know what's happening and caring for the back end of the claim and the electronic information. So we're here to help. And hopefully you've learned something today. And we really, really love partnering with you. Thanks so much for listening to Help, I Have Kids. If you're tuning into this podcast, that means you're a mom who's curious, committed, and ready to learn. And we see you. We'd love for you to join our Help, I Have Kids Facebook community where moms just like you are connecting, asking questions, and encouraging each other every day. It's a space for real conversations, expert insight, and support from moms who get it, because we're all in this together. And if you know a mom who's feeling unsure or maybe overwhelmed or just needs to be reminded that she can do it, she can advocate for her child with confidence, share this episode with her. We're building a village here, and we're glad you're a part of it.